Welcome back. We're happy to have with us in the studio Dr. Noouf Al-Mutar, a senior specialist dermatologist here at Jaber Al-Ahmed Hospital. Dr. Noouf, welcome to Medical Talk.
Thank you for the invitation and thank you for having me in the program.
Thank you so much. We have so much to talk about. But in the beginning, I would like you to give our viewers an idea of, or explain what is basically the atopic dermatitis and how different is it from other skin conditions and how common actually it is.
Yes. So atopic dermatitis is one of the atopic diseases that includes atopic dermatitis, allergic rhinitis, asthma, and food allergy. Okay, it's a chronic inflammatory immune skin condition. Now, how common is the disease? It's a fairly common disease. Nearly 230 million patients are suffering from atopic dermatitis around the globe. With the prevalence that is estimated to be 15% of the general population. Now, I don't have the exact prevalence of atopic dermatitis in Kuwait, but we do see a lot of patients in our outpatient on the daily basis.
Exactly. And can you at least give a brief definition? What is basically the atopic? Because a lot of people, they say it's like eczema.
An inflammation of the skin.
Okay.
Yeah.
So it's just an inflammation?
Dermatitis, it's inflammation.
Okay, yes.
Dermatitis is an inflammation of the skin.
Regardless of the causes. We're going to talk about the causes of it.
Of
because my next question is the main causes and triggers of the atopic dermatitis.
Yes.
And is it genetically, hereditary linked?
Mm-hmm. Okay, so atopic dermatitis is a complex disease, okay? It occurs due to the interaction between several pathogenic factors. We have the hereditary and the genetic factors. We have the environmental factors that includes, for example, weather extremes, emotional stress or infection. And finally, we have the immunogenic factor. People with atopic dermatitis, they have a problem with their immunity that lead to epidermal barrier dysfunction. The epidermis is the upper outer layer of the skin. So when the skin is disrupted, this will lead to easy access of the pathogen and the allergens, leading to the atopic dermatitis.
I see. And in terms of the signs and symptoms of this condition, are there like an early signs for this?
So actually we have acute and a chronic phase of the disease. So patients with acute atopic dermatitis, they usually present with intensely pruritic erythematous patches. These patches are associated with exudation, vesiculation, and even fissuring of the skin. And usually patients with acute atopic dermatitis complain from severe itching and pruritus. On the other hand, patients with chronic dermatitis, they present with lignified lesions, meaning that the skin itself is thick, it's scaly, rough, and hyperpigmented.
Yes.
Now, the location of the disease also differs according to the age. So infants, usually the disease in infants, it tend to be more generalized, but most commonly it will affect the forehead, the cheek, the neck, and the extensor surfaces of the elbows and knees. During childhood, the location will shift. It will involve the flexural surface of the elbows and knees, as well as the wrist and the ankle. In adulthood, no, it will be more localized. So the patient will, for example, have eyelid dermatitis, perioral dermatitis, head and neck dermatitis, and so on.
Okay. You mentioned children. So at what age does the atopic dermatitis usually typically appear? And are there like a certain age group that more susceptible for this condition?
Yeah. So atopic dermatitis can occur at any age group. Actually, we have neonatal atopic dermatitis, childhood atopic dermatitis, adult, and even senile atopic dermatitis, where the signs and symptoms start at the age of 60. But most commonly, in 85% of the cases, it starts before the age of 5, but it can occur at any age.
So we can see it as early as
1 year.
1 year?
Yeah.
Oh. So they need to seek medical attention as soon as they see it.
Yeah.
Okay, because sometimes, as I said, this could be confused with allergy.
Yeah.
And they might shift their attention or treatment to allergic reaction.
Yeah, it's as I said, it's atopic dermatitis is part of atopic diseases. One of the atopic diseases is food allergy.
Yes.
So they are related to each other.
So through your experience, how does this condition impact the patient's daily life? I mean, is it serious, both physically and emotionally?
Yeah. Dr. Mohammed, unfortunately, atopic dermatitis has a high physical, psychological, and social burden. Because most of our patients are young, visible symptoms and signs greatly affect their quality of life. In addition to that, because most of the patients suffer from pruritus, this can disrupt the sleep cycle. And we all know that whenever the sleep cycle is disrupted, this will affect the mood of the patient and also the productivity. So unfortunately, atopic dermatitis affects severely the quality of life of the patient in a negative way.
Absolutely, and especially I would assume for younger patients like females and teenagers, stuff like when they go through this, all these changes, and whether it's in their faces or in their body, they might be more affected negatively. Yes.
In the society, you have a stigma.
Yeah.
Whenever the patient is itching, they think that he's contagious, or he has poor hygiene. And this is wrong, because it's an immune disease. They have an inflammation of the skin. That's why they itch.
Exactly. And, you know, having the luxury of going to the pool and swimming with their, you know, clothes on and stuff like that is quite challenging. I totally understand. We do have more questions to ask you, but we have to take a short break. We'll be right back. Stay with us. Welcome back. We're still talking in the studio with the Dr. Noouf Al-Mutar. Dr. Noouf, before the break, we were talking about this condition, which is quite important, the atopic dermatitis, also known eczema. Now, can it lead to other health complications if left untreated? Because a lot of people, they might go for many, many years without seeking medical attention for this condition. If left untreated, could that lead to more complications?
So treatment of atopic dermatitis is vital and crucial. We have to treat the condition whether the patient had mild, moderate, or severe disease to prevent the complications of atopic dermatitis. Now, the most important complication is secondary infection, whether it is bacterial or viral. And then we have the post-inflammatory hyperpigmentation or post-inflammatory hypopigmentation. So we either have increase in the pigment or decrease in the pigment at the site of the atopic lesions. So we have to treat the patient as soon as possible to prevent these complications.
Especially if there is like a scar left after the lesion that they have.
It is usually harder to treat than the disease itself.
All right. And so what are the latest treatments available right now for managing atopic dermatitis? And do lifestyle changes, because it's like a double question. The lifestyle changes play a role in treating this condition?
So regarding the treatment, treatment depends on the severity of the disease. Patients with mild disease, usually we treat them with topical corticosteroids or topical calcineurin inhibitors. The topical calcineurin inhibitors, these are steroid-sparing agents. They don't contain a steroid. So we usually use them for areas such as the face or skin folds, or as a maintenance therapy after a corticosteroid course. Patients with moderate to severe disease, we usually treat them with immunosuppressant medication. Phototherapy also can be an option. In case of failure, then we treat the patients with biological treatments. Now, biological treatments are very unique. As I mentioned earlier, because atopic dermatitis is an immune disease, and they have a problem with their immunity, they have increased production of certain immune proteins. That's why biological treatments are unique, because they target these specific proteins. So they are very safe and very effective.
Okay. I'm sorry, because a lot of our viewers, they don't understand what the meaning of biological treatment. Is it like an injection? Is it a pill? Is it a cream? What are we talking about?
We have now 3 forms.
Okay.
It comes as a cream or an injection or a tablet.
Again, depends on the severity of the case.
Depends on the condition and depends on the overall condition of the patient, and the age and the condition.
Exactly. I was going to say, assuming also the age is a big factor, because children, they might not be able to tolerate certain medication.
Yes, you're right. You're absolutely right.
That's wonderful.
Now, regarding the lifestyle changes.
Yes.
Okay,
Yes.
Now, the patient education and patient counseling is as important as the treatment itself in atopic dermatitis.
Absolutely.
This is very important.
Yes.
So we always advise our patient to moisturize more frequently throughout the day with a fragrance-free moisturizer. And the moisturizer itself, it should contain ingredients such as ceramide, glycerin, and urea. These are important in restoring the skin barrier, and also it will lock in the moisture. Okay. Another advice is we always advise our patient to avoid wearing irritating fabrics, such as wool, polyester, or nylon. Instead, we advise them to wear clothes made from natural fabric, so cotton or silk. We also advise our patients to avoid irritants, like dusty weather, harsh detergents, bukhur, perfumes. And finally, although it's very hard, but we advise the patient to keep their stress level as low as possible.
As much as
because it's one of the triggering factors.
Exactly. And eat healthy and
yes, of course.
Of course, exercise that helps.
Yes,
I would assume.
Of course. Obesity is not only associated with more severe diseases and more relapses, but also the effect to the treatment is less.
Exactly.
With obesity.
Smoking is not helping, basically.
Yes, of course.
Absolutely.
Of course. Yeah. Whether it is first hand or second hand, they should avoid smoking.
Because it will elicit the reaction, basically. And it makes now, it's quite challenging for parents, especially for the children, with this condition. As a parent, what advice do you give them to manage this condition and to take care of this condition for their child?
The same as avoiding the triggering factor, but now we have a method of primary prevention. What I mean is high-risk families, they can take probiotic. When I say high-risk family, I mean either the father or the mother, they have a strong personal or family, positive family history or personal history of atopy. Not just atopic dermatitis, but atopy. So allergic rhinitis, atopy, and food allergy. So if the father or the mother, they have a strong personal or family history of atopy, then we advise the pregnant lady to take probiotic during the third trimester, and then continue to take the medication during the first 6 months after delivery with exclusive breastfeeding. Now, this will not prevent the development of atopic dermatitis, but it will decrease the risk of developing atopic dermatitis.
For the child, you mean?
For the child, yeah.
Okay.
Now, probiotics is a very hot topic.
Yes.
Many scientists believe that any altered in the gut microbiota can help in the development of certain diseases.
Yeah.
And when it comes to atopic dermatitis, there is a strong evidence that shows that it can decrease the risk. It will not prevent, but it can decrease the risk.
Well, that should actually come from counseling with the OB/GYN as well.
Yes,
and teach
right.
the mother, the future mother, that she needs to seek attention from the dermatologist and how to manage it during pregnancy.
Of course.
Because as you know, that leads me to my next question. A pregnant lady could actually experience changes in their skin.
Yeah.
And that could actually mimic or confuse with...
Of course.
Yeah.
Of course.
So that also needs to be addressed as well.
Yes. So during pregnancy, because of the hormonal changes, a patient can experience increase in their skin lesions and increase in the severity. But not all patients. Some patients, the opposite. The symptoms decreases with pregnancy and improve.
And it's quite challenging to treat,
of course, because we have limited options.
Exactly, for the medication that you can give for a pregnant lady. Now, are there any preventive measures that someone can do, especially if you have a history in the family with eczema?
Yes.
For example, if I know my dad had it, my uncle, my aunt, my mother, okay, is there any preventive measure that I can do to avoid having such a condition?
Yes, as I mentioned, the probiotics. The probiotics is the new preventive measures.
And also the
exclusive breastfeeding, at least for 6 months.
Breastfeeding?
Yeah, exclusive breastfeeding.
Exclusive breastfeeding for the first 6 months?
Yes.
Okay, in terms of when they get older, as you mentioned earlier, moisturizing? Yes,
of course.
Hydrating?
Follow all the preventive measures. Moisturizing is the #1 enemy for atopic dermatitis.
Yes.
So, xerosis or dryness is the #1 enemy. So we always advise them to moisturize more frequently throughout the day.
It's quite challenging now in Kuwait, especially with the weather. As you know, it's quite dry weather, hot in the summer, and dry and cold in the winter.
Yes.
So it possesses a challenge, I would assume, for the patients who already established, they already have that condition.
Yes, unfortunately in Kuwait, the prevalence is high due to the high level of allergens. We have dusty weather, we have dry weather, we have a lot of bukhur and perfumes due to the culture and the society. All these are irritants. So we try to tell the patient to avoid them as much as possible. to prevent the severity of the disease. So if it's, for example, it's dusty outside, we advise the patient to stay at home.
Yeah. And if it's very hot outside as well,
Yeah.
try to keep cool and, you know,
Yes, yes.
stay away from the sunlights for, you know, for any high exposure for the high temperature, basically.
Yes, you're right. Yeah.
Now, my next question is this. Is this something that you can live with? A lot of people, they might, especially when they first been diagnosed, they might have a severe negative impact on their emotion, basically, and their health. Is it something that, in your opinion, because you see this on a daily basis, is this something that actually you can live with? You know how to if you know how to manage it, or is it something that basically will require a constant attention from a physician or a dermatologist, and you kind of like go in and out hospital all the time?
Yeah. So atopic dermatitis is a chronic disease. Till date, there is no permanent cure. A patient can be in remission, but they can relapse whenever it triggers. Now, during the last 2 decades, there is an explosion of research and studies when it comes to atopic dermatitis. And there is a lot of new treatment. And with this new treatment, a patient can be in remission for a long period of time. So I think the future is bright for atopic dermatitis patient, and they can, inshallah, and hopefully, they will live with a normal skin.
With the stem cell research as well going on?
Yes.
We don't know what's going to happen?
Yes, of course.
Okay, before we let you go, I just want to very quickly touch on very important concept or different condition, because a lot of people are confused between the two. We have psoriasis and we have eczema. And these are 2 different things. And a lot of people are confused.
Actually, they are completely different diseases.
Exactly.
Now, both are immune diseases, but psoriasis patients will present with erythematous scale covered by thick silvery, erythematous plaque covered by thick silvery scales. The age of onset is also different. In psoriasis, they present during the 2nd and 3rd decade of life, but in atopic dermatitis, usually they present at younger age. The treatment is also completely different. Psoriasis is also associated with a lot of comorbidities, hypertension, diabetes, dyslipidemia, and even psychological condition. In atopic dermatitis, the associated diseases is different, associated with food allergy, with allergic rhinitis, and asthma. So they are completely different diseases. But yes, you're right.
Because a lot of people,
they confuse between
exactly, and they come to your clinic and they will assume that because they have eczema, they will think it's a psoriasis when it's not.
Yes,
or the opposite. If they have psoriasis and you will tell them like, no, you have a psoriasis, that's a different line of treatment and a different line of management, basically.
Yes, that's why seeking medical advice is very important to give the proper treatment.
Dr. Noouf, Al-Mutar, Senior Specialist Dermatologist at Jabal Ahmed Hospital, thank you so much for being with us and sharing all the valuable information.
You're most welcome, and it's my pleasure.
Thank you so much. Dear viewers, we still have more. Stay with us.